to talk to you about a key presentation tip that will get more patients to go ahead with Ideal Care. Janice Wheeler here. I'm the president of the Art of Management. Now, if you're a healthcare professional, I bet you $100 million that you actually have to make presentations to the patients of what they need to have as their next service. Pretty much can't imagine how you can get away from that. I know people try having treatment coordinators and so on, but the patient doesn't want to hear it from anybody except the doctor who's the expert, who looked in the mouth or looked in the dog's mouth or took the x-ray and read it correctly, or whatever your profession is, you're the expert. So I need to hear from you as a patient what it is that I need to have, and then you have to figure out how to get me to want to go ahead with that particular procedure. And money does become a factor for some people. It doesn't mean it should be or that it has to be, because I know from our first year in business when I had to have an awful lot of dentistry done, for instance, a lot. I was a bad dental patient before we started this business. And it cost a lot of money, and I didn't have any, but I borrowed it and borrowed it and borrowed it and borrowed it and kept going because my dentist was one of my clients who had done our sales training and knew how to get me to want to fix things and to take control of my situation. And it was awesome, and I'm forever thankful to him. I should say his name, but I guess I shouldn't. Anyway, I love that guy because he was so good for me and really helped me go ahead with all the Ideal Care, and we saved all except one tooth. And it took 20 years before that tooth, oh, longer than that, about 30 years before I lost it, that particular tooth. Anyway, my point here is that patients don't always say yes to you, do they? You try and present what they should be having, or they're the client and it's an animal that you're talking about, and you present the best possible service. Whatever your profession is, I know you want them to have the best. So then it's a matter of how do you get them to agree to it. So we have a whole sales training workshop that we do with our clients and their staff that totally trains everybody on every aspect of getting patients to accept Ideal Care. So I'm going to take a little piece out of it for you that we can do in a very short amount of time here. And basically, when you get to, you've done the exam and you've done the diagnosis and you found out what they think is the matter and you know what's the matter, and you figure out how to get them to switch gears and follow you to the conclusion that you came to. And then you say, you know, this is what you need and this is how much it is. Now, this is very important because often doctors call it findings and recommendations, you know, when they get to the point of telling the patient what it is that they need to do, which is fine to do that part, the findings. But recommendations is a bad word, okay? I just want to put that out there. If you say to me as a patient, I recommend that you do this, or Janice, you should do blah, 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 that means I don't have to. That's exactly how I've always taken it. It got me in a lot of trouble because I didn't realize that I was misinterpreting those words, but everybody does. When you say I recommend, it means you're not like 100% that I have to have that. Or you say you should have that, it means it's not that important. That's the literal interpretation by this particular patient. And so I didn't go ahead with certain procedures, and I'm lucky I have as many teeth left as I have because you know, that's just wrong. It's all wrong that I would take it that way. So here's what you do instead. You say, Janice, you need to have a blah, blah, blah. You need, if you're a chiropractor, you need to come 3 times a week for a couple of weeks till the pain is gone. But keep on coming after that because the condition may or may not be handled, and I'll let you know when it's all handled. All right? Because we want you not to have this condition come back again, right? And you build agreement with them. So you see how you said you need to have blah, blah, blah. And you don't go, well, you know, you need to have, you know, Do not sound wishy-washy. When you know what the correct ideal procedure would be for that patient, you say, you need to have blah, blah, blah. You need to do blah, blah, blah. That way, the positivity is there. And in addition, it's a very good thing. This is a very corny thing in some ways, but it actually is something that works, and all good salesmen do it. And you probably do it unconsciously, but if you do it a little bit consciously, you might become more in control of it. You nod a bit. You say, Mrs. Jones, or Mrs. Wheeler in this case, you need to have a crown on that tooth. Or Mrs. Wheeler, your dog needs to have some dentistry done, so we need to get at it as quickly as possible. There are definite problems there. And I'm sure you want to avoid bigger problems developing because we didn't take action now, right? And you see how I'm just nodding a bit to give you the positivity with that. I also did a little thing that we call building agreement by giving consequences. So you told me, Mrs. Wheeler, your dog needs blah, blah, blah. And if we don't go ahead with that now, this is what could happen, and we want to avoid that. Am I right? All right. That way you've got their agreement that they're going to go ahead with the procedure. You don't have to say, so shall we go ahead and do it? Because that could be a yes or a no answer. You want to build agreement on a couple of things if you can, getting them agreeing with you. Let's take optometry, for example. We have optometrists as clients, as well as dentists, chiropractors, veterinarians, optometrists, physios, naturopaths, and so on. Did I forget somebody? Denturists and chiropodists, which is a foot doctor. All right, so let's take optometry. And Mrs. Wheeler, you need to have a new pair of glasses with a new prescription in them. Number one, the frames that you have are pretty beat up looking. I'm sure you agree with that, right? Yeah, so we got some great stuff in our dispensing area. I'm gonna have one of my staff show you some of the best stuff that will look great on you. Secondly, the prescription is no longer correct for you, and you probably have noticed that you can't read as easily, especially at night, close up. That's because your eyes have changed, and we need to strengthen the close-up part of your vision. So, good news, we have lots of beautiful frames, and I'd like to walk you over there now and get you started. It was simple. Nothing more to it than that. And, so don't think that this is really super complicated. It's actually super easy once you get all the parts in place. Just remembering to say you need, and then to figure out, well, what if they don't go ahead with it? And say, your eyes aren't going to fall out of your head if you don't get the new prescription. However, they may hurt, and you want to avoid that, right? Have you been feeling eye strain at all? Exactly. Well, that's because your eyes are not as strong for seeing close up as they used to be. And there's a prescription change I'm not recommending, but I'm making in your prescription so that you won't have that strain. And that'd be good, right? So you can read freely, play games on your tablet, whatever you do that's closer up. So let's get you over to the dispensing area and have a look and see what's available. Okay? Good. Come with me. Okay, so that was just a little example of you need, and a little bit of building agreement with them that they don't want to have that problem. You often know what the problem is when they came in because you asked them when you started, like, have you noticed any changes in your eyes if you're an optometrist? Or why are you here today? For any profession, they say, oh, I'm having trouble reading. At night, I find my eyes are getting very tired and I can't see the words as well. So you would know that at the beginning. Dentistry, you could take any profession, and from the first conversation that you have, because you always should find out why they think they're here today and what they think the solution is and what they've done to try and handle the problem and all of those good things, so that you have the tools you need and the phrases that you need for later when you're building agreement that they don't want to have that problem anymore. Am I right? You want to avoid that, right? That's something you'd like to get rid of, right? So, or am I right? Or you'd like to get rid of that, wouldn't you? Questions like that, we call that building agreement questions. Okay, good. So that's my hot tip for today. If you are interested in what we do as a whole, because we do all aspects of practice management from marketing to sales, obviously, we do a very in-depth training on that. And we do dealing with statistics and how to make them go up instead of sideways or down. And we help with every issue that you could possibly have staffing wise in your practice. So give me a call, because I do a free in-depth practice analysis. We've worked with 1,800 doctors now, and they all started by meeting with me. A couple maybe not. I had another person selling for a while, years and years and years ago, but mostly it's been me. I've done 6,000 of these meetings, and I'm really good at finding what the holes in your practice are and working out exactly how much I think your practice would increase based on fixing those situations that you've got going on. So it's 3.5 hours long. There's absolutely no charge for it, and there's no obligation, honestly. It's a get to know each other, and if you like what you see, then you can choose to become a client or not. Okay? Very good. So, subscribe to our channel, because we have playlists and we have our own channel. And give me a call. I would love to talk with you. So give us a like and share this, and see you next time. Bye.
To get your practice analyzed, contact the Art of Management at 416-466-6217.